ICD-10 and risk adjustment. So we were asked, ICD-10, what was the impact or has been the impact on risk adjustment? The question that came in actually stated, how has ICD-10 impacted risk adjustment conditions? Depression is an example. It will be important for the provider to mention the severity, if it's mild, moderate, or severe, or the clinical status, since in ICD-9, depression was coded out as 311. Now it maps to major depressive disorder, and that is F32.9, which carry two separate risk adjustment scores. 311 doesn't risk adjust, and the new ICD-10 code does. So what do we do about that?
Hold on, that link's not working. Gotta find it.
That's okay. I started on my, I probably had it up on my screen, and I thought at the last minute, oh, I don't need that on there. Well, while she's pulling that up, I'll let you know that in some of the investigating that I did, I expected to find more diagnoses that risk adjusted in ICD-10 but did not in ICD-9. I thought that I'd find at least one more other than depression, because risk adjustment coders just know about this because of the transition. This is something that they, we educated everyone on. You wanted to capture that, but there really isn't anything else yet. So now that we've talked about that, let's scroll down a little bit and let's look at the comparison of ICD-9's 311 versus the ICD-10 code. So 311, depressive disorder not elsewhere classified. If you've been coding for years, you're well aware of this code, and it risk adjusts only for an RX HCC. Okay, so when someone says, well, it doesn't risk adjust anymore, it does risk adjust, but only for on the prescription level. All right, so let's move the page a little bit and see what our ICD-10 code does, though. So F32.9, which is major depressive disorder, single episode, unspecified, it has an RX HCC of 134 for depression. However, if the provider mentions that it is a mild, moderate, or severe, it carries a CMS HCC and a ESRD HCC as well. So, when you're looking at the documentation, one of the things that a risk adjustment coder does is make sure that these chronic conditions are coded to the highest specificity. We saw that with the osteoarthritis, right? The different variables in that. In this case, if you just translated the depression code as F32.9, then it's not going to get the risk adjustment, the reimbursement that is needed for the care for this patient, unlike if it is mild, moderate, or severe. So scroll up just a little bit. Let's look at the F32 categories. These are all the options for the single episode, right? So they want to know mild, moderate, severe without psychotic features, with psychotic features, in partial remission, in full remission. These codes risk adjust at a higher level, right? So what does that tell you? That means, one, you need to be aware of all of the possibilities that surround a diagnosis. Now, is the provider documenting this information or not? Now, if he doesn't document it, you can't code to a higher specificity, but most likely he is documenting to this. And if he isn't aware that he can document it, then your role as a coding specialist is to let him know that these codes in ICD-10 are available, and it does make a difference in reimbursement, right? So keep in mind what ICD-10 actually allows you to do, unlike 9, it allows you to capture the etiology, anatomic site, and severity, as well as, encounter status. But those are what makes differences with ICD-10 in comparison to 9. Now, I found this little note that in some of my research, the CMS, they just put out the benefit and payment parameters for 2017. You can go to the CMS website and pull this up. Just put that in the search. However, what's interesting is these parameters are trying to look, one of the things they do is look for things like this change in the risk adjustment from 9 to 10. But the 2017 report is going to be on codes from 2012 and 2014, which are in ICD-9. Okay, so it's going to be another year before we get this. Now, last, to sum all of this up, I found this statement, and I've got the, you can look at the footnote for the link. It was on Versic Health, I believe. This really sums everything that I would want to tell you up, is this statement. So scroll down just a little bit here and let's look at this. The question had been asked, so what does this mean for a risk adjustment coder in 2016? What can we do now to take care of the challenges ahead for this transition, as we're getting it, we're out, as we get into it after a full year of ICD-10 use and we start seeing these things. Now, I'll let you read that, but I underlined and highlighted the key points. One, what does this mean? It means you need to include ongoing provider and coder education opportunities. You can come to CCO. You need to make sure that your providers and your coders are educated and have resources at their disposal so that they can capture any of these little nuances. Also, that it's going to mean that you need to continue to do analysis and reviews of provider documentation. You're going to, being a risk adjustment coder means you're audited constantly. If you can't accept being audited, then that's probably not a credential or a pathway I would take. It's, they say, well, with coding you want to be 95% accurate. It's 99% accurate that they want. It's quality over quantity with risk adjustment. And so you audit other people, they audit you. It's just a process that you go through. And it's very, very important. And you have to make sure you're not missing opportunities to find existing and suspected conditions. Okay, that's a big part of what risk adjustment coders do. And then it all sums up in what we've highlighted. I couldn't have worded it better. This requires that health plans have a strong risk adjustment coding process, dedicated claims to coding review process, and a provider engagement team to educate the providers on these opportunities while also improving the logic in the claims processing system to identify overcoding. So again, it's all about a team, teamwork. You're auditing each other. It's about education, communication. All of this really is what you need to strengthen your understanding with risk adjustment. And you want to have a immensely strong understanding of ICD-10. You want to know it inside and out. Now, it doesn't happen overnight, but when you like it as much as I do,